Let's get started. Welcome to class, everyone. So I've just had this recent update that someone's having some elbow problems. As a tennis player and as a tennis trainer, chronic elbow problems is something I'm quite used to helping, medial and lateral epicondylitis. So let's all regard your elbow first, please. Thank you. This is called the medial aspect. This is the inner aspect. Gently take your left thumb, apply that left thumb to the lateral aspect of your forearm. Thank you. And then go ahead and open and close your fist. You'll notice here that, you'll feel that a lot, particularly through the pinky finger. Do me a favor now, allow yourself to open and close that right hand for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Thank you. Open. Now circle through that right wrist, please. 10, 9, 8, 7, 6, all the while maintaining some pressure here. 5, 4, 3, 2, and 1. Other direction. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Thank you, and release. So instead of you digging around with your thumb and trying to get things to work that way, applying slow, steady pressure and secondarily manipulating is a far better approach. Now, what if you have lateral epicondylitis? One is golfer's elbow, one is tennis elbow, and to tell you the truth, I can't keep it straight, so I always just use the technical term. So medial, and now here's lateral. So this is the outside of your forearm, okay? Allow yourself to gently take your two fingers here, depress just like you did with your thumb, and you'll find it's kind of a bit nervy. Don't go so big. Open and close your hand, and you'll find that the structures underneath are activating and deactivating. Go ahead and do that again for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Open the hand and circle. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Other direction. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Shake it out. Remember the massage technique I had shown you guys where you put a little bit of salve or balm or nothing at all? Slow, steady pressure starting here at the fossa, and then you can go down and away. Same thing on the inside. Down toward the bone at the fossa and then toward the wrists. And you'll be able to do a good job of releasing that. Got it? Got it good? Can't remember? Lucky we have the second side. Okay? So, on the left side, pinky side, allow yourself to take your thumb, apply a bit of steady pressure in there. It's a bit nervy. You can almost feel that connection with your pinky finger, can't you? Allow yourself to apply a bit of slow, steady pressure. Open and close that left hand. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Circle, please. Now, you're not trying to get pain. You're trying to get release, right? So the intention of the thumb there is to bring awareness so that you can choose to relax that area. 2 and 1. Other direction. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Thank you. Second side. 2 fingers. Applying to the outside here. Oh, it's particularly tight on me. I'm going to find it there, move my thumb, and it should light up like a Christmas tree for you. Open and close that left hand now. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Thank you so much. Circle. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Other direction. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. Once again, maybe starting here with your the palm heel, press toward the bone, glide down toward the wrist, a couple times on the inside as well. But don't forget to end with a bit of effleurage, a little bit of nice circulation, encouraging movement. Got it? Got it, good. And notice, hey, pretty good. When we have a joint issue, it's not like you should be taking anything and digging around in the fossa. Neither should a therapist or anyone else, right? Unless you're a surgeon and you know what you're doing. Because it's just very sensitive and likely to do more harm than good. However, if you go below and above the joint, relieving muscle tissue, relieving some connective tissue with some of that work that we just did, you're going to do a lot of good. This goes for knee. So if my knee is hurt, I will release the hip and the ankle and the stuff in between, above and below, and good things happen. So when your elbow is hurting, don't try to dig around in here. I really don't suggest it. Instead, relax the musculature above and below the joint, and you're going to get far more relief. Now, the nature of these sort of chronic injuries, it could be some sort of gift from your parents, or it could be a mechanical action that you're doing on a regular basis. If you're typing or doing something as a tennis player, of course, you're going to be susceptible to this. What's important is trying to spend some time investigating what makes it worse and spending some time regarding what makes it better. That way you can help to modify and make changes. Because if you don't get at that sort of base causation, you're just, kind of running uphill here by treating the symptoms. However, if you can't find the cause, then that's the best we can do so far. However, it doesn't hurt to do these things now so that you feel better while you pursue the identification of the cause. Okay? So thank you so much. I really like treating acute injury. It's not that I like you guys getting hurt. I like the focus that it brings. And I think that when you have an acute injury, it can be very useful in terms of seeing a different perspective, my perspective, and maybe some of the methodologies so that you can take them for yourself. Now remember, all of the things I'm offering you are suggestions and have been learned through my training and experience. Of course, if it's a persistent injury or your hand's falling off, go see a doctor right away. I'm talking about a physio, kinesiology-based intervention that will encourage and facilitate healing. Okay? Thank you so much. Not to take a shot at chiropractors, but I would not be as reckless as some of them who make claims about protecting you from COVID, right? That's not this work. I will say that being healthy and happier and having a good meditation and restful practice that reduces your stress levels makes you more resilient and therefore maybe better capable of managing a potential COVID infection, but I would never deign to say that there's a direct protection from this work, okay? I never said that. Now, what I do say now is I'd love for you to gently and easy, please, go ahead and rock over to your left hip. As you can see, I'm leaning here on my left hip, my left hand is down. Why? Because I'd like you to extend that right arm nice and long. Hug it through the core and engage. Allow yourself to reach that right hand fingertips as far as you can. Take it as far forward as you can, as far above you as you can, as far behind you as you can, feeling that full range of your shoulder, and circle, please. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Other direction, 10, 9, 8. I want you to notice how I'm trying to re-engage my core and let all the mobility be in my shoulder. 5, 4, 3, 2, and 1. I'd like you to contrast that with this. Gently, please, extend the arm. Go ahead and roll the chest downwards. Fold a little bit. Reach back into a bit of a back bend and circle. So previously, it was all arm. Now, I'm including the body and hip rotation. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Other direction, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Reach, 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 please, and relax. Thank you. Feeling that through the shoulder, maybe even the bicep and elbow, and also through the low back and hips. All right, let's go. Second side. So you're just finding your second side, placing that hand down, extending along through the arm, hug through the core, immobilize the spine a little bit, and just let all the work be in the shoulder. 10. See, my body's not moving at all. 9, 8, 7, 6, 5, 4, 3, 2, and 1. Other direction, please. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. So really good shoulder focus, but now we're adding the body. So let's reach forward, lean back and around for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Other direction. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Beautiful. Thank you. I'm a little dizzy. I'd actually like us to continue, and we're all going to go a little bit further. Check this out. Left hand, please. Fingertips on the shoulder. Same rotation, but now we're taking the hand out of the equation. So I want you to really emphasize the big circle here for 7. Make this elbow circle as big as possible. 6, 5, 4, 3, 2, and 1. Elbow circle on the left as big as possible again. 7, 6, 5, 4, 3, 2, and 1. Thank you. Now before we go ahead. Knees are still down. Take that right hand behind your back. And we're going to do 5 of these. Same sort of circle. My knees are bent in front of me. I think that you can see that here. Good. And now circle. 5. 4. Whoa. 3. 2. Right hand behind you. And 1. Other direction. 5. 4, 3, 2, and 1. Switch. So go ahead and take your knees the other way. Thank you. So we did the full rotations with the wrist already. We're going to take our right fingertips towards deltoid here. Left hand is supporting. Gently roll forward. Try to make that right elbow circle as big as possible. Thank you. Circle. 6, 5, 4, 3, 2, and 1. Other direction, please. 7, 6, 5, 4, 3, 2, and 1. And relax. Wait, last one, remember? So we're going to come up here, take that left hand behind our back, and just 5 of these, circling. 5, 4, 3, 2, and 1. Other direction. 5, 4, 3, 2, and 1. And relax, please. Amazing. Allow yourself to sit nice and easy. Thank you. So I'm going to come up a little closer so that you can see. I'm turned here so that you can see this right shoulder. Got it? Got it? Good? Thank you. Go ahead now and take this right hand behind your back. You can grab hold of it with the left hand, that's fine. Feel that right shoulder dropping. Feel that? And then lifting. Lower and lift. 10, 9, 8. Now remember, the more tension you put on with the left hand pulling this right hand back, the more stretch you're going to get. 6, 5, 4, 3, 2, 1. Up and hold. Good. Now circle. 7, 6, 5, 4, 3, 2, and 1. Other direction. 7, 6, 5, 4, 3, 2, and 1. Okay. Same thing. Let's pin this right hand as far over to the left and up as you can. See my hand in my back? Good. Hold it there. Drop this right shoulder, but drop the left ear now. Oh, got it? Small circles. Slow and easy. You want to feel this. Don't avoid the feeling. 5, 4, 3, 2, and 1. Other direction. 5, 4, 3, 2, and 1. Relax that right shoulder down. Maybe manipulate the neck and head a little bit. Relax your jaw and release. Oh. Shoulder mobilization and stretches. Nice job, everyone. Second side. So I'll turn my second shoulder toward you. Thank you. Allow yourself to take that left hand behind your back. Maybe hold it with the other hand and drop that shoulder down. Good. Head is neutral for now. Here we go. Lift and lower. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Awesome. Good. Here we go. Maybe find a bit more bind, taking that arm in a bit more. Stretch that shoulder and circle. 7, 6, 5, 4, 3, 2, and 1. Other direction. 7, 6, 5, 4, 3, 2, 1. Awesome. Take a deep breath in and a deep breath out. Maybe add a bit more stretch, and this time drop that right ear. Soften your face, soften your ear. Maybe a few circles. 5, 4, 3, 2, and 1. Other direction. 5, 4, 3, 2, and 1. Awesome, everyone. And gently, easily release. Good. I'm going to stay here in profile because I would like you to consider your shoulders again. Okay. My hands are just resting on my thighs here. I'm sitting up nice and tall. Inhale and exhale. Keeping those shoulders down. Gently draw them together in front of you. See that? And then draw them behind you. Hugging into the core, remaining stable. Forward, 3, 4, back, 3, 4, 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 relax. Little tricky here. Draw this left shoulder back. Got it? Right shoulder forward. 10, 9, 8, 7, 6, 5. Keep the shoulders down. 4, 3, 2, 1. Relax. Draw that left shoulder forward. Draw that right shoulder back. Got it? Go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Switch. 3, 2. 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 And relax. So I'm hoping that you didn't turn your waist. Instead, it was the shoulders that were changing positions. This one's interesting here. Ready? Let's lift that left shoulder up toward your ear and draw that right shoulder forward. Keep it down and forward. 10. 9. Keep that shoulder up. This one down and forward. 8. 7. Do you feel effects in your low back? 5, 4, 3, 2, and relax. Whew. Okay, so this left shoulder goes forward. Sorry, I should say down and forward. This one goes up and center. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Oh, so strange. What if we encourage this shoulder to come down? Actively stretch this left shoulder down, and then actively stretch this right shoulder back. So you see it going backwards. This one's down, this one, the right one's back. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Thank you. This left one relaxes, it goes back. The right one goes down. Left side back, right side down. Don't turn from the waist, it's the shoulders that are moving. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax, please. Beautiful. Now I often have you do this, and I often have it face on so that you can see. Today I'm going to show you in a profile. Gently take your elbows, interlace the fingers, take them together. Good. Now I want you to notice that as I go through this work, I'm not going to be deflecting my body in any way. It's going to stay nice and tall. So my elbows stay away from my body. I'm going to go down with my elbows. Inhale. And now exhale up with the elbows. Oh! See how my elbows are squeezing together? And my body does not change. My hands do not change. I'm going to go down and up. Oh, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And up and hold. So notice I'm not deflecting in my body. My elbows are simply lifting upwards at a great cost of effort, and my elbows are stuck together for 10, 9, 8, 7, 6, 5, 4, 3, 2, and relax. Oh, shoulders. Inhale and exhale. Inhale and exhale. Now when we stretch shoulders, it's it's not an uncommon circumstance we feel tension in our necks, because our necks are often a release valve for shoulder tension. Try to maintain some neck relaxation as we continue to work through the shoulders, okay? Extending this right arm long, take this left hand on top, and then bind your hands as best you can. If this is not in the cards for you, then you can just go here and just kind of hug in, or whatever you can, all right? Big breath in and a big breath out. Got it? It doesn't need to look pretty, you just need to feel stretches on both shoulders. Now, I can see that on my left side, my left shoulder is right toward my ear. I'm going to try to drop that left shoulder away from my ear and keep both shoulders down, away from my ears. That's the intention. So try for a moment to inhale and exhale and drop that left shoulder away from your ear. Lengthen your neck and body upwards so that your shoulders are kind of normal. I still see that there's an angle. I get that. But I want to reduce that angle as much as possible and have the intention of dropping my left shoulder. Got it? Got it, good. Inhale and exhale, try circling now. Oh, that left shoulder should be experiencing a mighty bit of stretch for 10, 9, slow and steady, 8, keep that left shoulder down, 7, 6, 5, 4, 3, 2, and 1. Awesome. Other direction, please. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1, and relax. Oh. Inhale and exhale, inhale and exhale. I'm not trying to do this on purpose, but if I relax both my shoulders, you might notice that my left shoulder here is lower than my right shoulder. That's because of the stretching. If that's not the case, that's okay, but take a moment now and just feel the left side of your neck. I'm suggesting that it might actually feel a bit more released, because that tight shoulder work that we did, that was quite a bit of effort, it can be extremely effective and I think is worthwhile. Okay, second side, here we go. Left hand forward, right hand over top, twist and draw in. Oh, Chris, okay. Left hand forward, right hand over top, hug that right elbow toward you. And you'll get that similar sort of locked in sensation. Otherwise, feel free to wrap around. Now, my right shoulder is totally higher than my left shoulder, right? I'm gonna take a deep breath, inhale and exhale. I'm gonna try to relax my right shoulder down. I'm gonna try. It's not very successful, is it? I'm gonna try. I'm gonna try to lengthen my head up. And I'm gonna just spend a moment here, because I think that getting my right shoulder down is really hard for me, and I want to be able to, because it will facilitate release. So if it's hard for you too, take a deep breath in and a deep breath out, and relax that right shoulder. Okay, good. So my shoulders are almost at level. It's okay if they're not exactly. Try to keep that right shoulder down as you now circle. Oh, it is very tight in there for me. 9, 8, 7, 6, 5, 4, 3, 2, and 1. Other direction, please circle. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Awesome. Lengthen up and hold. Drop that right shoulder a little bit longer. 5, 4, 3, 2, and relax. Oh my. Inhale and exhale. I think I'm actually sweatier or more heated than when I do push-ups and sit-ups. The reason why is I'm efforting these smaller muscles to open them up, and that I find is much more challenging and far less efficient than even a sit-up or push-up or something. If that's the case for you, join the club. It's very, very normal. Thanks everyone. Take a deep breath in and a deep breath out. Go ahead and press the palms together. Thank you. Lift those elbows so that they're in line with the palms. Go ahead and squeeze. Good. Now, shoulders down. Ooh, interesting. So elbows are still up, but shoulders are down. Can you draw the hands down a bit more so that they're below the height of the palms or the elbows? Check to see. Relax the shoulders. Now, here's a neat trick. Inhale and exhale. My shoulders are forward here. I'm going to draw them back. Neck back, shoulders back, wrists down. Hold there. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Got it? So we can feel those isometric engagements, and although they're isometric, they're very active. Okay, we're gonna go for a similar effect here, right? Left hand, right hand, palms, fingertips pointing downwards as best you can. Notice here that your shoulders immediately climb up toward your ears. Yeah, we don't want that. So relax the shoulders down, lengthen your neck. And once again, my shoulders have rolled forward, as you can see, right? I'm gonna take a deep breath in, deep breath out. I'm gonna hug them backwards and down. Backwards and down as I press into my palms still. And I'm gonna ask you to stay there with me, trying to get the shoulders back and down for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Okay, does it get a little bit worse? A little bit. Palms together, fingertips forward. See, This all day. You can do this all day, right? Inhale and exhale. Gently and easy, please. Fingertips are forward. Draw the elbows wide. Now lift the elbows above the big, the thumbs, please. But drop the shoulders down. And draw the shoulders back. Okay, my shoulders are back. My elbows are above my wrist, I hope. And I'm lengthening, trying to breathe. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Now there's this phenomenon. Sometimes people do this and they don't get it or they don't feel it. It may not just be that you're born very flexible that way. I'm really happy for you. But there is a circumstance that I often encounter where people can't actually activate their muscles, so they think that they're doing it, but they're not. So I just want you to pay attention to see if you're just that flexible or if really you're not able to activate the muscles. Because if that's the case, that's not a good circumstance, because you want to have that awareness. You want to have that ability to activate through your back and through the shoulders. Okay, last one. Palms together. Good. Fingertips upwards. Good. This sucks. Fingertips toward you. Good. Try, please, to take your thumbs below the level of your elbows, if it's available to you. Good. Squeeze. Drop the shoulders down and draw the shoulders back. Whoa. Use your core. Use your breathing. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Oh, check it out. Compound stretch. We got wrist, we got elbow, we got chest. Very beautiful, everyone. Thank you. Do me a favor. We're going to take one of the classical sort of gym, phys ed type of stretches, and we're going to break it down a little bit to make it a little bit more effective. I use it today because it's something that we can do just about anywhere. Go ahead and extend that left arm out to the left, lift it up, and take that left hand behind your head. You've seen this before, right? Take a deep breath, inhale and exhale. Go ahead now and draw this left elbow to the right. Feel that stretch? Sure you do. The key here would be to drop that right shoulder, that right elbow, lift that left shoulder, lift that left elbow, and then go over to the right, please, keeping your body planar and neutral at the neck. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Stay here, but take the pressure off. Something that we can consider doing, please, is taking your left hand up, if you can reach it, and pushing that elbow down. So imagine this left hand presses that elbow down toward your head. All right? So I don't expect you to fit your elbow behind your head. That's crazy. Some people can go here, though, and then guide their elbow down. If you can, reach here and just kind of maybe tug at the forearm or the whatever and pull that hand down behind your head. Ready? So up here, push that elbow down behind your head and lean to the left a bit more, to the right a bit more, and breathe. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Come up, relax a little bit. Now, the down is good, but there's also this. Lift that left hand again. Now take that right wrist or forearm and pull. You're not pulling downwards toward your hips, you're pulling across the body to the right. So take it and pull across to the right. See that? Find that stretch for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, neutralize, but leave it there. Chris, that's enough. There's actually 2 more, but I'm only going to go for 1 and maybe just touch the other, okay? So what's going to happen is I'd like you to consider reaching up, grabbing the elbow. You're going to pull down and across at the same time. So you're pulling down and across. Notice how the back of my left hand and my right elbow are in contact? That's the theoretical next one. So for now, I'd like you to pull down toward your hip, pull across at the body, for 5, 4, 3, 2. Now you can continue for the next 5, but if you want a bit more because you're flexible enough to do so, take that right elbow, please, and press that left wrist forward. Wow! So I'm pulling down and to the right with my elbow and arm, and I'm using my right elbow to press my left wrist forward for additional stretch. 7, 6, 5, 4, 3, 2, and release. My favorite joke again, was that a stretch for the neck or for the shoulder? Yes, it was. It was certainly a stretch for both, I think. Inhale and exhale, take a moment to manipulate your neck. Check out that beautiful flow of circulation in the arm. I think it's lovely, and I'd like you to continue that on the second side, all right? So let's all go back to Zen in gym class where the teacher instructs you to extend your right arm, take the hand behind the head, and just lean over to the left. Oh, countless, let's see, aerobics classes, 20-minute workout classes where they have you do this. Inhale and exhale, relax the chest. 10, keep stretching to the left. 9, 8, 7, 6, 5, 4, 3, 2, 1. Gently back off. If you recall, the first iteration is a push downwards. So grab the wrist and pull down, or grab the elbow and push down. Once you've got it pushed down as far as you'd like to, then lean to the left again. Oh, 10. Key here is not to force yourself to go forward. You want to be able to sit up tall. 9, 8, 7, 6, 5, 4, 3, 2, and 1. Awesome. Thank you. So the combination, the 3 and the 4, right? So grab hold of the wrist or whatever. Pull that arm over. Got it? Once you've pulled it over, lean. 10, 9, 8, 7. Sorry, combination is next. 6, 5, 4, 3, 2, 1. Relax for a second. See, the combination of pushing down and pulling to the left is what we're after. But if you notice, my right hand is in front of my left elbow. So I'm going to push my elbow down behind my head. I'm going to pull my right elbow to the left for 5, 4, 3, 2, 1. And then if I want to and you want to, take your left elbow, push that right hand forward and down and to the left for 5, 4, 3, 2, 1, and release. Shoulders and neck. So there's that joke again, was it for the shoulders or was it for the neck? Yes, it was. You can feel that effect very distinctly through the neck and through the shoulders, which I think is best, right? Stretching the neck without stretching the shoulders doesn't really work. Likewise, stretching the shoulders without stretching the neck also doesn't work. So thank you for doing both with me. Inhale and exhale, not quite done yet. I'm going to introduce you to my least favorite stretch, and we know why, because it's the one I'm worst at, okay? So, very simply, take your right hand, please, behind your back, palm holds the side back portion of your body. You see that? Right? It's not rocket science. It's like, the side part of my back, something like that, okay? Now, someone like me is like, I'm supposed to be able to do this, and it hurts my ego, it hurts my feelings sometimes, but I'm supposed to be able to reach over and grab my tricep and pull it forward. Right now, I can only get to my deltoid maybe. Other people can get all the way to the elbow. Yeah, that's good for you. I cannot. So if you can reach all the way to the elbow, wonderful. If you can't, join the club. Relax that shoulder down, and now draw that right arm forward. So I'll show you from the side here. I'm here, and I'm taking my arm, and I'm pulling it forward, please. That's all I've got. I'm supposed to be able to wrap my hand around the tricep and pull it forward. It's not happening, and that's okay. I'm bad at this, but I know it's something that I have potential of improving. To facilitate this improvement without grabbing my tricep, what I'm going to do is I'm going to really focus on lengthening my back, Really focus on honestly and purely stretching my shoulder forward and not like hitching forward. And I'm really going to try not to judge. Okay? 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1, and relax. Oh, sorry. Chris, I'm not even in the ballpark. I can't even touch my shoulder. Then, if that stretch is something you really want to try, you can get a strap or something, hook it there, and then pull through. I have to do that. I do. I have to work really hard to get to the point where I can touch my shoulder at all, right? This is as a result of the pronation and repeated work of my tennis stroke. It may also have to do a lot with my parents, but whatever the reason is, I know that preventing me from having that range of motion is not a good thing. Second side, right? Let's see how it goes on the second side. So we're going to take our left hand, palm touches the side of the body, right? So my palm is touching the back side of my body, just at maybe just below my low ribs. Good. And as I sit, I'm going to take a deep breath, inhale and exhale. I'm going to walk my fingers across. Oh, look, I've got a little bit more. Look, I'm at the tricep. And I can pull it forward. Great. Inhale and exhale. Maybe it is due to my forehand. I don't know. But the point is that on both sides, I'm equally experiencing challenge. It just happens to be that I can stretch this one in a greater range, but I'm still just as challenged. I'm going to sit up tall, inhale and exhale. I'm going to relax my left shoulder down as I try to use my right hand to pull that left tricep and left elbow forward. Inhale and exhale. Thank you. Inhale and exhale. Thank you. Experience this work as very best you can. Relax through the neck. Relax through the shoulders. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax the head, relax the face, and release. Oh, pretty sweet, eh? Check out your arms. Nice full ranges. Beautiful, everyone. Thank you. Now, we're not quite going to lay down yet, but we're going to come close. We're going to do some reclining postures that will stretch the arms. Let's go now. So go ahead and lengthen your legs nice and straight. Inhale and exhale. The left hand is going to go behind you, palm down, fingertips pointing backwards. My right hand is going to go behind me, palm down, fingertips pointing backwards. And I'm going to lean back, please. Inhale and exhale. Now, as you can see, there's a bit of a back bend. That's okay on this occasion. Inhale and exhale. Take that bit of a back bend. Roll the shoulders back and together and lift that chest, please. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And relax, please. Do me a favor, take a deep breath, inhale and exhale. How about we bend the elbows a little bit? Draw the elbows together, roll the shoulders back toward each other. Inhale and exhale. Thank you. And then take that back bend again. Oh, interesting. So my elbows are tracking toward each other right now. See, they're tracking toward each other. And my shoulders are back, squeezing my scapular blades and rhomboids. And I'm letting my chest lift. And I'm taking this nice deep back bend through my low back. Nothing is crunching, nothing is hurting. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Thank you. Straighten the arms, neutralize the body. Beautiful. Big breath in, big breath out. But just because I gave you the back bend on those doesn't mean I'm going to let you keep it. Walking the arms straight. So let's go ahead and neutralize this body. I'm not going to back bend at all. My core is engaged. I'm laying back flat. My left arm and my right arm are back. Good. Hug in through the core. Flatten that back. Flatten that neck. Got it? Arms are relatively straight. Now here's the deal. Press your palms into the floor slightly. Oh, feel your arms light up like a Christmas tree, keeping that body nice and neutral for 10, 9, 8, 7, 6, 5, 4, 3, 2, and relax. Ooh. Okay, so these are relatively locked out positions. That's why they're isometric. I want you to just engage in those positions to get some deeper stretch. Thank you. Let's turn your fingertips lateral, so they're pointing outwards. They're pointing away from each other, okay? Same thing, body neutral, walk the hands back, but my fingertips are pointing to the sides. Good. Keep the arms straight. Do not bend the elbows. Do not exaggerate the shoulder roll. Don't. Keep it neutral. Inhale and exhale. Got it? Got it, good. Now what I want you to really focus on is pressing the pinky pad down to the floor. Ready? Neutralize the chest and press down that pinky pad to the floor. Oh, feel that type of forearm engagement. Got it? Got it, good. 10, 9, 8. Should be feeling the lateral aspect of your forearm. 7, 6, 5, 4, 3, 2, 1, and ulnar nerve. Relax, perfect. Big breath in, big breath out. Thank you. We're going to rotate that, fingertips point toward each other. Careful with your wrists, please. So neutral body, straightish arms, neutral chest and shoulders. Good. Big breath in, big breath out. Now press the thumb mound, the big fleshy part of the thumb and the palm into the floor. So you're feeling some medial stretch to the forearm. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and gently release. Thank you. Take that right arm, please, under, grab hold of your left shoulder. Thank you. Grab hold of that right shoulder and try to stack the elbows. Does this look familiar? Does it look like that cow's face pose? Well, you got it. That's exactly it. Take a deep breath, inhale and exhale. Now, the thing is that this isn't really a shoulder piece. This is more of a core piece. Because I'd like you to inhale and exhale. Tuck the chin in, roll down vertebrae by vertebrae. Control your core. So there goes my pelvis, my belly button, my shoulders and back, and then my neck. Hold there, please. Inhale and exhale. Let's go again. Looking at your belly button, lifting up the cervical spine, pressing that area between the shoulder blades, below the rib cage, low back, and up. Thank you. Switch. Try to touch each of the vertebrae down individually. Here we go. Gently tuck the chin in, roll. Try to get that space below the belly button to touch the floor first. And then each vertebrae individually. And eventually your neck. Beautiful. Inhale and exhale, tuck the chin in. Cervical spine up. Good. Folding there below the shoulder blades. So just below my shoulder blades is on the floor. Then I'm going to go and transit between my area below the shoulder blades to my belly button, below my belly button, and up. Got it? Got it. Good. Inhale and exhale. Release the arms. Go ahead and relax down. Oh, beautiful. Inhale and exhale. Arms up, please. Pressing through the wrists. Keep those shoulder heads down and away from your ears. Lower the hands. Keeping those fingertips up. Notice here that your low back wants to pop up. Don't let it. Hug in through the core. Keep it neutral. Lifting up. Fingertips touch. Forearms touch. 10, 9, 8. Try to get them to touch at the same time. 7. That's a hard thing. 6, 5, 4, 3, 2, and 1. Beautiful. Thank you. Rotate those hands, fingertips away from each other. Pinky fingers touch. Thumbs touch. 10, 9, 8, 7, 6, 5, 4. Keep control of that core, please. 3, 2, and 1. Awesome. Palms press, fingertips roll inwards. Oh, shoulders down, away from the ears. That's hard. Thumbs touch, pinkies touch. Ugh, that's hard. 10. Touch, touch. 9, 8, 7, 6, 5, got it. 4, 3, 2, 1, and relax. Shake out the arms, please. Inhale and exhale. Inhale and exhale. But you got it. You know what I'm going to do. Keep shaking all the way from the wrist to the elbow to the shoulders, keeping those shoulder heads on the floor. 30 seconds, please. Inhale and exhale. So don't shake it as hard as you can. Shake it as well as you can for the period. Inhale and exhale, please. Inhale and exhale. Coming up on 5, 4, 3, 2, 1. Excellent. Halfway there. 15 more seconds remain. Keep on going. I miss seeing your faces and the swearing in the mouth that usually comes when I do that. Inhale and exhale. And relax the arms. Beautiful work. Big breath in, big breath out. Beautiful. Do me a favor now. Extend your arms nice and wide, open into a T. Flip the palms downwards. Relax the shoulder heads. Relax the underarms. That's the stretch. Inhale and exhale. Close your eyes and breathe. As you do so, the palms are down, the elbows are resting. I'd like you to rest your arms on the floor. Try to relax as much of your palm and forearm and your biceps or whatever, triceps, I can't remember which side it comes down, all the way through. Relax your neck and your throat. Find your breath here. Inhale and exhale. Inhale and exhale. Okay, just another 15 seconds. You can do this. Inhale and exhale. Your neck is long, shoulders are relaxed, back certainly relaxed, please. Inhale and exhale. Inhale and exhale. Beautiful. From this extended position with the palms out and down to the floor. Yes, good. Bend the elbows 90 degrees. Hopefully keeping your palms toward the floor. Good. So I'm in sort of a cactus pose. My palms are on the floor, my elbows are on the floor. I'm relaxing my chest wide. Imagine the elbows going as far away from each other as possible with the palms relaxing down. That's a tough deal. Your upper shoulder and back, imagine that someday drifting down toward the floor. Someday. Inhale and exhale, please. Inhale and exhale. Have you ever seen those macro shots, like popping corn or an egg frying? It's really beautiful, right? You don't even know what it is. It's so close up. You see the bubbles and the air and the transformations that you're mesmerized, or at least I am, by seeing something so close and how beautiful it can be. I like this type of work because it can be a little bit like that. We worked the shoulders today, and we looked at so many different spots, so many different ways, so closely that I find it mesmerizing. I don't think it's useful to be this detailed all the time, but taking this opportunity once in a while to acquaint ourselves to these more mysterious spots can be extremely beneficial. Thanks everyone. Gently release the arms, shake them out. Good. Extend the arms out to a T, palms open. Let your fingers relax so that they do have a natural curl, but see if you can relax your fingers so they don't curl. Maybe in a few more lifetimes I'll be able to manage that as well. But the intention here is to let the musculature and soft tissue soften so much that the back of your hands and your arms are relaxing, relaxing, relaxing. Big breath in, Big breath out. Try to avoid the temptation of grasping, clasping, clenching. That's not what you need to do. Let go, let go, let go. Inhale through the nose. Exhale through the mouth. Inhale through the nose. Exhale through the mouth. Thank you. Just another 15 seconds or so. Beautiful. Thank you. Inhale and exhale, please. Inhale and exhale. Now, Chris, I can't bend my elbows like that. That's not what I want. I want you to take your hands out into this cactus pose, right? And relax your fingers and shoulders and elbows. And imagine again your elbows are moving as far apart from each other as possible, but also your shoulder heads. Imagine your shoulder heads, instead of being shrunken up here, are widening and broadening, as are your elbows. Imagine your latissimus dorsi down here, and the rotator cuff muscles that we worked so hard the other day. Imagine them relaxing to the floor. 15 seconds remain. Inhale and exhale. Inhale and exhale. Maybe you can distract yourself with the idea, the notion of, this really affects my low back. You betcha. Relaxing the upper back, or the joint above the area of interest, has a lot of effect on the lower back, right? As I said, if my lower back is hurting and it's so tender to the touch, I wouldn't go and massage it incredibly. I would release my glutes, I'd release my shoulders, so I could take pressure off of my low back. So it's not a surprise. Thanks everyone. Release your arms into a place of comfort and just breathe. Inhale and exhale. When a place is injured or fatigued or tired, it doesn't always help to directly affect that area. Maybe it's so injured and so tired it cannot heal, no matter what intervention you may put upon it. Rather, you've got to let it heal by clearing the way, right? The snowplow thing, but this time you're doing it for the body, specifically with the intention of healing. So by releasing the upper chest here, the neck and shoulders, you are taking a lot of burden off of the back directly. By releasing the hips and the glutes and the hamstrings, we also take a lot of burden off that back directly. We go above and below the joint. We did it here at the elbow. We do it in our bodies during these practices often. Sometimes the most direct stimulation of an injured area will not be productive because it's too injured. Remember that one of the primary ways I like to assist the healing process is through awareness. But if a person has too much shock, too much damage, lacks insight, or is just incapable of that awareness, I can help them, but I need to help them to develop that awareness in order to have a more longitudinal healing outcome. Otherwise, maybe it's akin to just getting a shot and you feel better for the moment, but resetting the pattern or avoiding patterns in the future that might cause that injury become less likely. And I'm hoping that with that awareness, you'll be able to school me on how you have been able to avoid patterns or opportunities for injury because you become more aware. Thank you, everyone. Gently roll over to one side, your very favorite side. And notice how, even laying on the side, your neck release and your shoulder release serves you in good stead. I'm hoping that it helps you to relax, to lay down in bed. Because just as important as working out in the gym, eating your meals and doing work to get paid, being able to rest at night and sleep, we need that. It's where we heal, it's where we grow, it's where we re-energize. So I'm hoping that this work will also facilitate that process. At any rate, thank you so much for joining me. I get the honor of helping you out again one more time this week. I'll see you then. Take care, everyone. Thank you.